Good morning. My name is Ruth and I'm a student nurse practitioner. I am going in my patient's room today to do an abdominal exam. Alright, let's go. Good
Good
morning.
morning.
My name is Ruth and I'm your student practitioner today. How are you doing?
I'm good.
Good. Would you please state your full name and your birthday?
My name is Nathan Magai, and I was born November 30th, 2002.
Very good. So Nathan, today I'm going to be doing an abdominal exam on you. Is that okay?
Mm-hmm.
Very good. So the first thing we do is check with the patient. Are you having any problems, Nathan, with your stomach?
No.
Okay. When was your last bowel movement?
Um, Yesterday.
Yesterday. Very good. Was it normal?
Mm-hmm.
Good. Are you having any problems urinating?
No.
Okay, the reason for checking to see if the patient has had any problems with bowel movements or urination, if it's men, you want to check so you know if they have any problems with prostate enlargement and things like that. Also, if it was a female, I will ask them the last menstrual cycle. All right, Nathan. So with your stomach, the first thing I'll go, please put your arms straight. Examine the hands and the nails. Very good. And sometimes you're also checking to see if there's any clubbing. So Nathan, if you can put your index finger together, make sure they're aligned. There's no clubbing and it looks very good. Also, I need to check his eyes just to make sure they're not yellow to indicate any liver problems. Looks white and nice. Very good. Then the next thing I'll do, I will have the patient. Is it okay to raise your shirt, Nathan?
Yes.
Thank you. If it was a female, I'll go ahead and cover I will not expose their bottom or I will not expose their upper chest. The first thing we do with abdominal exam is to do an inspection. So I'll go ahead and look at the abdomen. Make sure it looks good and symmetrical. Very good. I don't see any obvious swelling. I don't see any mass. I don't see anything protruding. Very good. Once we do the inspection on the abdomen, the next thing we're going to do is we're going to listen. So we're going to auscultate. We're going to use the diaphragm. I will listen to all four quadrants, and then I'll also listen with the bell for the arterial sound. So we'll start with the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Once we finish with that, we are going to go ahead and listen with the bell for the arterial. This bowel, it has good bowel sounds. They're all active. The next thing we're going to do, before we palpate, we are going to percuss. And we'll do the entire abdomen. Once we percuss, we're going to do a light palpation on the abdomen. Once we finish percussing all the four quadrants, what we were doing when we percuss, we were looking for the spleen dullness, the gastric air bubble, and also the liver borders, just to make sure everything is okay. So the next thing we're going to do, we are going to palpate. First, we start with light palpation. So we are going to palpate the abdomen. And we're going to do all four quadrants. So just walk way around lightly. And one of the reasons why we auscultate the patient before we palpate or percuss is we don't want to move any organs or have them shift out of place, and then you won't be able to listen. All right, so continue doing your deep palpation in all four quadrants. This time you're also checking to see if you see any swelling, any mass. You're checking to see the liver, the gallbladder, the spleen, the kidneys. So now we're going to do a deep palpation. Do you feel any pain anywhere, Nathan?
No.
Any tenderness anywhere?
No.
Okay. When you get here, just make sure you go around, deep palpate. This will help you determine if there's any mass or anything unusual. Also look at the umbilical cord if there's anything unusual or any deviation. And also for patients that have things like colostomies, make sure you also check to make sure everything looks good. Once we finish that part of the exam, I'm going to have the patient sit up so I can complete the last part of the exam. Nathan, would you please sit up for me? Very good. You can just have your hands on the side. When the patient is sitting up, we are going to percuss, and we're going to percuss the costovertebral areas of the kidneys. This, we're just checking for tenderness. Any problems, Nathan? You
No.
feel anything?
No.
Very good. Very good. All right, Nathan. I'm going to pull your shirt down. That completes the abdominal exam. Thank you.